Welcome, everybody. We're now going to begin our discussion about stuttering, the introduction to fluency disorders. And everyone should have the Stuttering book by Barry Guitar. So we're going to be looking now at some information that will be handy for you. When we look at the difference between fluency disorders versus stuttering, we want to look at fluency as timing, rhythm, and effort, the effortless flow of speech. When we think about fluency, we're thinking about pauses and rhythm and intonation, stress and the rate that are controlled by when and how fast we move our speech structure. So in essence, when we think about speech, fluency, we're thinking of this effortless flow of speech. And to be judged to be fluent means to have little effort when speaking. So some of the variables that we look at when we think about distinguishing between fluent and disfluent speech, we're looking at the presence of extra sounds or repetitions, prolongations, interjections, or revisions. We're looking at the location and frequency of the pauses. Usually they come pretty regularly, but if somebody throws in a few extra pauses, then we're looking at how that is not fluent. We're looking at the rhythm of the speech, their intonation and stress, and the overall rate. When we think about stuttering, we think about the core behavior of stuttering, characterized by abnormally high frequency and or duration of stoppages in the forward flow of speech. So these can take the shape of repetitions of either sounds or syllables or one-syllable words. It can take the form of prolongations of sounds. It can take the form of blockages or blocks of airflow or voicing in speech. There are different types of fluency disorders. When we look at stuttering, we look at developmental stuttering, neurogenic acquired stuttering, and psychogenic acquired stuttering. We're looking at cluttering and even some neurogenic speech disorders. So let's talk a little bit about the developmental stuttering. Let's go back for just a moment to talk about the developmental stuttering. These are symptoms that are usually emerge gradually as a child develops their speech during the intense time of speech and language acquisition. When we think of developmental stuttering, we're thinking about the fact that there may be more boys than girls who do stutter. Actually, with young children, there's a 3-to-1 ratio. We're looking at this type of the stuttering begins during childhood without really an apparent link to psychological or organic trauma. But it's mostly this developmental stuttering is the most common because the symptoms usually emerge gradually as the child develops. Usually during, as I mentioned, that intense period of speech and language acquisition. So it has some similar fluency problems that are associated with psychological problems and brain damage and cognitive impairments and cluttering. But they usually come around childhood during that rapid speech and language development. And we see normally how children usually are first depicted as big having stuttering behavior reported by their parents. Many times some of what they seem to have is relaxed repetitions of syllables and words. That's usually the first signs of stuttering. And many times parents describe prolongations and blocks along with their signs of struggle. as the first stutters are shown by their child. So usually parents see their child as stuttering because of these marked disfluencies. But sometimes this may occur as a normal process of learning language, as the child has more to say than their mouth can move. Let's go back to the neurogenic types of stuttering, which can be caused or exacerbated by a neurological disease or damage. And this would now usually be acquired after childhood. This can happen perhaps with a stroke or a head trauma, a tumor, or a disease as Parkinson's disease. Many times we're now seeing that people that suffer from post-traumatic stress disorder, many active duty members can have injuries related to brain injuries and will develop a neurogenic stutter. That's also the type of stutter that I had mentioned previously in one of the classes about a young woman who had been in Mensa and had an automobile accident. Although she didn't think she needed any assistance, she didn't even go to the emergency room, but then she developed a stuttering pattern. When we talk about psychogenic acquired stuttering, it's also like a neurogenic late onset disorder. It may begin with prolonged periods of stress or after some type of traumatic event. And we know cluttering, that's more of a rapid speaking, that's difficult to understand. I'm actually working with a student right now who I would say is a person who clutters. Very difficult to understand, very rapid speech rate, very little timing between words, and I many times use a metronome to work with students that have that cluttering type of behavior. So let's look at the core behaviors of stuttering now, which are more like abnormal breaks in fluency. They have moments of stuttering or stuttering events or disfluencies, and these are what we call those core behaviors. Mainly it was adopted from the term from Van Riper. He used it to talk about basic speech behaviors of stuttering, looking at repetitions, prolongations, and blocks. And he mentioned that these behaviors seem to be involuntary to the person who stutters, as if they're out of their control. And these definitely differ from the secondary behaviors that a stutterer acquires as they learned reactions to these basic core behaviors. So let's talk for a minute just about some of these core behaviors. The repetitions, which are mostly observed in young children who are just beginning to stutter. There usually are simply a sound or a syllable or a single syllable word. It's repeated several times. It's like a person is stuck on that word. So sometimes you might hear a child say like this, where they're stuck on the word and they're just repeating it. I had a little boy that I worked with that would say want, like I want something. So lots of a repetition. Prolongation of voiced or voiceless sounds also appear in the speech of children beginning to stutter, and they usually appear somewhat later rather than the repetitions. So these prolongations is used to depict when a sound or the airflow continues, but the movement of the articulators is stopped. So prolongations can be as short as a half a second, can be perceived as abnormal, but in Rare cases, they're longer than that, but they're usually quite short. And then repetitions and sound prolongations are usually part of those core behaviors of the more advanced stutterers, as well as children who are just beginning to stutter. And then blocks are typically the last core behavior to appear. So we see that blocks occur when a person inappropriately stops the flow of air or voice, and often the movement of the articulators as well. And this is pretty much an inappropriate muscle activity at the laryngeal level, and that characterizes most blocks. As stuttering persists, the blocks often grow longer and more tense, and you may even see tremors. You can try this if you were to say the word bye while squeezing your lips together hard, building up air pressure behind the block. Imagine this happening to you unexpectedly when you were trying to talk. So just put your lips together and hold and squeeze tightly, and then try to say the word bye. And that might feel what a person who stutters feels when they are in using a block aspect of their core behavior. So what are some of the differences between people that stutter? We see that stuttering has abnormal breaks in fluency, that there can be breaks in fluency that are normal, just like you and I. There are times you're talking to someone and you may just stop, you can't think of a word, or maybe you repeat the word, or maybe you have a block. It's sometimes difficult to differentiate the normal from abnormal breaks in fluency. So because of that, we needed to get an umbrella term for all breaks in fluency, whether they're normal or abnormal. And the word disfluency was developed. So disfluency with the letter I is equal to all breaks in fluency that are both normal and abnormal, while the word disfluency with the Y is meaning the abnormal breaks in fluency. So if there are normal breaks in fluency, we would call that normal disfluency. And we can see it as this. In the realm of disfluency, which we all have at one time or another, we have normal disfluency, or we have the disfluency of the stutter, the moment of stuttering, or that stuttering event. Lay people often refer to normal disfluencies as stutters. And we always want to use the person first language. A person who stutters or a stutterer. Usually type would rather use the word a person who stutters to make it worth while for that person to feel that they're still a person first, and the stuttering is a behavior, but not to identify themselves as a stutterer. It really does affect their psychological makeup, and it affects the way they see the world and how others see them. So it's really better if you could say there's a person who stutters rather than, oh, here comes the stutterer. Doesn't sound that good. Doesn't make that person feel that good either. And all of us at some time or another may have moments when we do have cause to stutter, and we wouldn't say that we are a person who stutters a lot, but there may be moments of it in our own speech and language. So when we look at stuttering, we're looking at core behaviors, we're looking at speech rate, secondary behaviors, avoidance, and feelings and attitudes of the person who stutters. So when we think of those core behaviors, as I mentioned, we're looking at the repetitions, the prolongations, and the blocks. We're looking at the rate of speech. How fast is someone talking? We're looking at secondary behaviors. Now, these would be learned reactions to the basic core behaviors. If we look at secondary behaviors, someone who may be blinking their eyes as possibility, or someone who thinks they're going to stutter on a word and so they avoid that word. That would be another secondary behavior. What kind of secondary behaviors can you think of? Have you ever seen a person who stutters, and seen a different secondary behavior? Um, it's a way that they react to their repetitions, their prolongations, and their blocks by trying to end them quickly if they can't avoid them altogether. So we may have escape behaviors. There may also be avoidance behaviors. And those are the two divisions that we look at. Um, so the term escape or avoidance are pretty much borrowed from behavioral learning literature. Escape behaviors occur when a speaker is stuttering and attempts to terminate the stutter and finish the word. So some examples of this escape behavior are eye blinks, head nods, interjections of extra sounds such as which are often followed by the termination of a stutter and therefore reinforced. Now, avoidance behaviors, on the other hand, are learned when a speaker anticipates stuttering, recalls the negative experiences he had or she had when stuttering, and to avoid the stuttering and the negative experiences, well, they resort to behaviors they've used previously that to help them escape from that moment of stuttering, and that could be an eye blink or an So they try something different as changing the word they were planning to say. In many cases, especially at first, those avoidance behaviors can prevent the stutter from occurring. They can be very rewarding and give emotional relief from the increasing fear that a stutter will occur. But then soon these avoidance behaviors become strong habits, and then those are pretty much resistant to change. So we may see these subcategories of avoidance, such as postponements, or starters, or substitutions. Sometimes I've had people that I've worked with that have actually had hand movements where they actually took their hand and kind of patted it down on their thigh, just timing to saying the word. So just remember then, when trying to decide if a secondary behavior is an escape or an avoidance, just remember that an escape behavior occurs only after a moment of stuttering has begun, and an avoidance behavior occurs before the moment of stuttering begins. And now, lastly, let's look at the feelings and attitudes of a person who stutters. And a person's feelings can be as much a part of the disorder of stuttering as his speech behaviors. Feelings can actually precipitate the stutter. And so we might see in the beginning a child's positive feelings of excitement or negative feelings and of fear, which can result in repetitive stutters that child may hardly notice. But then these feelings may make speaking harder and harder as the child may begin to repeat words and become more frustrated or ashamed because what he wants to say, even maybe his own name, is not as smooth and as quick as others. So we might see that the fear of stuttering, the guilt of not being able to help oneself, maybe even hostility towards listeners may occur. And then the attitudes are feelings that have become a pervasive part of the person's beliefs. So as the person stutters, he experiences more and more stuttering, and he begins to believe that he's a person who generally has trouble speaking. And that's just going to create that cycle of shame, of negative attitudes about themselves derived from the stuttering. And most research shows that even people that stutter, are maybe tense, insecure, and fearful. And those individuals who stutter see themselves changing themselves, or feeling that they can't change their negative attitude about themselves. So these are some of the areas and the issues that we see when we talk about stuttering. I hope this has given you some more information, some more insights. Please make sure you come to Monday's class on April 3rd, where you will be able to see a person who will share his life, his feelings, his attitudes with us. And his name is Rigoberto Garcia. You will be very delighted to meet him. He's becoming a speech-language pathologist himself, and he will give us great insights into the world of stuttering and what it's like to be a person who stutters. And you may also find what he says on one of the quizzes down the road. So I really suggest and highly suggest that you come to class and give Mr. Garcia your undivided attention. Have a few questions ready for him, and have a wonderful rest of your spring break, your holiday. If you're having a holiday, if you're having any break. Okay, everybody, have a wonderful, wonderful rest of the week. Take care. See you all on Monday.